Hello, can you hear me?
Yes, doctor, we can hear you.
Okay, we'll start at 4 o'clock, is it?
Yes, sir.
Yeah, okay. Let me know. I'll be online.
Sure, sir, I will do. So, shall we start?
Yeah, sure.
Okay. Good evening, everyone. I'm Joanna from Equitas Small Finance Bank. Welcome to this special webinar on cancer awareness and prevention organized by the Shringeri Sharada Equitas Hospital. The Shringeri Sharada Equitas Hospital is a multi-specialty and cancer care hospital in Chennai managed by the Equitas Healthcare Foundation along with the Shringeri Mutt. The hospital specializes in providing holistic and affordable cancer care and treatment to all patients. Today, we have the privilege of welcoming Dr. Kiran Kumar, a distinguished oncologist from Shringeri Sharada Equitas Hospital. With over 8 years of experience in cancer research and treatment, Dr. Kiran Kumar has worked with some of the most esteemed institutions that include AIMS, SVIMS, Apollo Proton Cancer Center, and the Adyar Cancer Institute. Dr. Kiran holds an impressive academic background with an MBBS, MD in general medicine, DM in medical oncology, and MRCP, making him a leading expert in the field. Welcome to the webinar, Doctor.
Thank you, Ms. Shyam. Thank you for your kind introduction.
So, let's start with the basics, Doctor. So, what is cancer and how does it develop in the body?
So, cancer is not a single disease, as many people would like to think. It is a group of diseases, and each tumor behaves differently. So, the central picture is the cells. There are abnormal cells which grow and divide uncontrollably. These are the two keywords. Uncontrolled proliferation of abnormal cells is called cancer. Yeah. And cancer can develop in any part of the body, and cancer develops because the regulatory mechanisms in a normal cell are disrupted. So all of us will have trillions of cells in our body, and most of the cells will be dividing. New cells are being formed and the old cells die. So when these new cells are being formed, the cell actually multiplies, divides, and this division is very strictly regulated process. with a lot of genes called proto-oncogenes and tumor suppressor genes. So there are some genes which keep the proliferation in check. They're called tumor suppressor genes. And there are some genes which increase the growth, which are called proto-oncogenes. So if there is any imbalance in the regulation, the cells start to grow without any control. And also the second important thing, cells cannot die. So normal cells, as they age and mature, they die. But these cancer cells, they lose the capacity to die. So they become immortal, kind of immortal. And that's how the cancer keeps growing in the body. And basically, in common terminology, we call it as a tumor. Tumor is any lump or swelling in the body. And all tumors need not be cancerous. There are something called benign tumors, where the cells grow to a certain extent, and then they don't grow, they do not metastasize, they do not spread to other parts of the body. They are called benign tumors, which don't pose any threat to life. They can be removed. There are other type, which is commonly called cancer, is called malignant tumor. So when somebody sees some lump here and there, need not be scared that it might be cancer. It can be benign tumor many times. And cancer is a different thing, which keeps growing and then spreads to other part of the body. And as I said, basically why it develops is a lot of factors. I think we'll discuss in the coming minutes.
Sure, Professor. So, yeah. So, what are also the other specific factors that increase a person's risk of developing cancer?
So these factors, cancer we see in small kids also, see in young fit people, we see in elderly patients. One reason for cancer, there are many reasons, and I will categorize the reasons into genetic reasons, and then environmental reasons, and then the lifestyle reasons. The genetic reasons not in our hands, lifestyle reasons, yes, it's definitely in our hands, and environmental partly in our hands, right? And genetic reason, as in I told, there are two types of genes, right? Proto-oncogenes and then tumor suppressor genes. There might be an inherited deficiency or abnormality in any of these genes, and these inherited deficiencies will be transmitted from generation to another generation, from mom and dad. So we are made up of 50% of mom's genes, 50% of dad's genes, right? And if mom has an abnormal gene, there is a 50% chance that the gene might be passed on to me or not. Yeah. So these are called the genetic reasons. So the commonly what we see are the genes which everybody needs to know at this era is BRCA1 and BRCA2, BRCA1 and 2. So this is a gene which is responsible for almost 90% of hereditary breast cancer, which is one of the commonest cancers in our community. And apart from that, there are many other genes. The common syndromes, including colon cancer, is something called familial adenomatosis polyposis, FAP. So there's a APC gene. So this is the examples for the genetic reasons. And coming to the environmental reasons. So our environment, we can say that pollution is one thing. Pollution, especially air pollution, soil and water pollution, can actually increase the risk of cancer. I think recently all of us would have seen in the news Grant Johnson walked out of a podcast stating that the air quality is not good. So actually, if you look at it objectively, the air quality index of Chennai, the area where we live in, is around 110, 120, which is actually it's a moderately high, and it's equivalent to smoking 2 cigarettes per day. Yeah. So and then water, we can still purify using RO. Yeah. Soil, vegetables, pesticides, herbicides. Those are one of the reasons environmental, but it's not a very strong risk factor. So the most strongest environmental thing would be viruses. Okay, viruses, which might be surprising because in India, the second most common cancer in women is cervical cancer. In almost all the cases, it is caused by a virus called HPV, human papilloma virus. There are other HPV virus also can cause anal cancer, genital penile cancer in males, oropharyngeal cancer. There are other viruses like hepatitis B, which can cause liver cancer, H. pylori, which causes chronic acidity, gastritis, which can lead to stomach cancer in future. And yeah, so these are all the examples of the viruses and the environmental factors. And coming to the lifestyle, which is most important, which all of us have to introspect and think. The lifestyle factors include smoking, alcohol. Even though the cigarette pack has a graphic picture of tumor, but still people continue to smoke after looking at the picture. And alcohol is also a carcinogen these days. And then diet. So diet is something which nobody is sure of. What is a good diet? What is a bad diet? I think in this situation we need to use our common sense and actually think what actually suits our body, because we are born and brought up in a culture and in an area, and we our genes are acclimatized to whatever foods which are produced in this area and which happen in generations. So eating local produced foods, and one problem is the westernization of diet, which is causing increasing obesity and other lifestyle diseases like diabetes, hypertension, strokes, heart attacks. So the I can say the basic rule is everything in moderation. You cannot avoid everything. That's like leading a saint life. That's not possible for everybody. So everything in moderation, as much as possible. We need to avoid sugars. So the risk factors would be eating too much high sugars, refined sugars, processed meat, lot of red meat, and eating too much fats and obesity. These are all the lifestyle factors, and again, lack of exercise and a lot of stress, which suppresses our immunity, also predisposes to cancer.
Understood. Thank you, sir. So, one more question is, what are some of the most effective ways for people to reduce cancer risk?
Yeah, so the one of the most effective ways I would say would be to stop smoking and stop drinking alcohol or limit the usage of alcohol. And that's one thing which we can easily do. The second easiest thing would be to keep a check on our diet, and we can have some pizza occasionally, small quantity, a burger now and then. But if it happens like every weekend you have to have, or every movie night you need to have, that's not a healthy lifestyle. And in a day, when our plate should have carbs, proteins, fats, less of carbs, more of protein, and bit amount of fat, which includes the essential fatty acids, and also fiber. Fiber comes from fruits and vegetables. So this is called the balanced diet. So when you eat only uh, carbs, it is definitely not good. So you say I'm eating only one donut, doesn't have too much carbs, but it's not a balanced diet. It's just carb rich diet. So the diet should be balanced, and fiber is important to prevent colon cancer. And we need to avoid processed meat. What is processed meat? The meat, freshly cut meat, is a fresh meat. Any meat which is preserved by salting, curing, smoking, or barbecue, these are all the processed meat, like sausages and burger patties. These are all processed meats which are definitely carcinogenic. IARC categorizes them as class 1 carcinogen. That's one definitive cause for causing cancer. So we need to avoid all those, increase fiber, and then antioxidants we get from mostly fruits and vegetables, which are good. This is the second thing. The third thing to decrease the risk of cancer would be to exercise daily. Right? Not We need not go to gym every day, but at least 30 minutes of some moderate physical activity like walking, jogging, or some other activity will actually help to decrease the risk. And coming to the most important intervention which we can do at a hospital basis is the vaccination. So, as I said, cervical cancer is the second most common cancer, and it is almost completely preventable by using a vaccine for human papilloma virus. So, getting HPV vaccination and hepatitis B vaccination, yeah, that would actually decrease the risk of the cancer. And yeah, that's what I think. Wear a mask when you're when you're traveling to Delhi, yeah, using sunscreens.
Mm. Okay. So, early detection in cancer is like very important, doctor. So, what are some of the signs and symptoms that we should look out for to detect cancer?
So early detection is important because the cure rate actually changes with the increasing stage of the cancer. So cancer, we can divide it into usually 4 stages: 1, 2, 3, and 4. Stage 1 is when the cancer is in the organ of its origin. Let's say from breast cancer, the cancer is limited and small inside the breast only, nowhere else. It is stage 1. If it is slightly bigger or spread to some small nodes in your axilla, that's become stage 2. And if the cancer becomes too big and involves a lot of lymph nodes in your armpit, that becomes stage 3. It spreads to anywhere else, it's stage 4. So how actually, why are we staging? Because we are staged because it has a prognostic information. What do I mean by prognostic information is it uses information regarding how many patients we can cure, what are all the treatments which are required for that stage. So let's say breast cancer stage 1, almost 98% can be cured. Yeah, and stage 2 probably 85 to 90% can be cured. Stage 3 it drops down to 70 to 80%, and stage 4 long-term survivors like survive more than 5 years are hardly less than 20%. Yeah, so we detect early, there is a higher possibility of getting it cured. That's the reason we need to uh, detect it early. The second reason would be to avoid treatments. Like if you detect in a stage 1, with only surgery, the cancer can be cured. But if it becomes stage 2, I have to give chemotherapy. Right? Stage 1, I don't need to give chemotherapy. Patients need not take this chemotherapy radiotherapy if the cancer is detected in a very early stage. And also the financial burden. Right? Uh, Again, chemotherapy is expensive, radiotherapy is expensive, major surgeries are expensive, small minor surgeries such. So financially also it makes sense to detect cancer early. So we detecting cancer early, we cannot wait for the symptoms to. So that's the question is what are the symptoms? What are the symptoms where which we can think of cancer? But I don't think anybody should wait for the development of symptoms. But you always need to be aware of what symptoms. I can say there are general symptoms like fatigue, feeling tired, which is increasing day by day, which goes on for more than 2 to 3 weeks, or unplanned loss of weight. You're not dieting but still losing weight, more than 10% of your body weight. If you are 60 kgs, loss of more than 6 kgs in the last 6 months is significant. And loss of appetite, and any swellings, lumps or bumps in the neck or in the breast or in the tummy. So these are the sort of general symptoms. But the symptoms of cancer actually happen come out based on the organ in which the cancer is. Let us say if there is a colon cancer, it affects the gut, right? So there will be disturbance in the bowel movement. There can be constipation, there can be diarrhea, there can be blood in the stools. If the cancer involves the bladder, there can be blood in the urine or some pain while passing urine. If the cancer is in the breast, there will be a lump in the breast. If the cancer is in the lungs, it can be cough, sputum. When the patient is coughing, there might be a small amount of blood or breathlessness. And other common cancer like prostate cancer. Prostate cancer is usually seen in elderly people where they find it difficulty to pass urine. There will be poor urine stream. And the most common cause is called BPH, which is a benign condition. But when patient presents with those symptoms, we always have to do a test called PSA, which will again indicate the presence of prostate cancer. And for women, the second common cervical cancer, the symptoms include pain during intercourse or any bleeding or spotting which happens after intercourse. So these are the common symptoms of the common cancers.
Okay. Thank you, sir. So, what is the importance of early screening? So, how much does it impact us treating cancer and finding a solution for it?
Yeah. So as I said, screening actually makes sense because we detect early, we can cure better, we have better cure rates, and then there's less financial burden. So screening is definitely important, and community-based screening where we screen people on in large populations to detect early stage of cancers actually makes sense because the overall healthcare expenditure, the amount we'll spend on screening people will be small compared to the amount we need to spend for the treating the patients, right? We need to stop before a human being becomes a patient. Yeah, that's why the screening is very important. And there are guidelines for screening. There are some cancers which are shown to be should have a survival benefit. As in, when we detect early, definitely the success of cure becomes the chance of cure becomes better. The for women, screening tests include mammogram for breast cancer and Pap smear for cervical cancer. So mammogram in a woman who is after 35 needs to undergo yearly mammogram. And from the age of 30 years, need to do self-test examination. There are many good YouTube videos how to do self-test examination. And women need to aware of her own breasts, how they feel, how they look, and what is the shape and size of the nipple. This is called breast awareness. So from till 35, I think that is sufficient. But after 35, some kind of screening people need to be on. So preferably mammogram and or ultrasound breast also. So after 40 years becomes mammogram, and less than 35 to 40, less than 40 becomes an ultrasound. And this is done on yearly basis, once in a year. Only if a woman has a significant family history, has a genetic reason for to develop breast cancer, she needs to undergo screening once in 6 months with MRI once and then mammogram on the other 6 months later. This is about the breast cancer screening. For cervical cancer, pap smear. Pap smear is like a not routine gynae examination gynecologist does. A small spatula will be put into the cervix, and then it will be the scrapings will be taken from the surface of the cervix. There is not going to be any biopsy or a tissue taking. It's just a scraping of the surface. It's not painful at all, and these scrapings are examined under a microscope on a slide. And if there are any abnormal cells, this will detect a precancerous condition even before the cancer develops. And if we combine it with a DNA testing for the HPV, for the virus which I told previously, we can do this test once in 5 years. And any woman who has crossed like 20 years of age needs to undergo a pap smear, because by the time you get HPV infection and then it becomes a cancer, there's a lot of duration. And if you detect the cancer at a precancerous condition, there's a high possibility of preventing it to form a cancer. And then gender specific screening for men would be prostate cancer. Man more than 50 years of age, there's a role to do PSA, serum PSA for prostate cancer. And for both genders, let us say if there is a smoker with significant smoking history. We say significant when a person smokes more than 20 pack years. That means each pack of cigarette has 20 cigarettes, right? And if a person smokes one pack per day for 20 years, that's called 20 pack years. Yeah? And if he smokes 2 packs per day for 5 years, that again is so for 10 years becomes a 20 pack years, right? So anybody with more than 20 pack years history can undergo low dose CT scan. CT scan has high radiation, low dose CT scan has lesser radiation, which is safer. And starting from the age of 45 to 50, we can do an yearly low dose CT. And then colonoscopy, which is again very important. We are seeing a lot of colon cancers in Indian patients, especially in the younger age. So starting from the age of 40, once in a year colonoscopy would be sufficient if somebody doesn't have family history. Or a test called stool occult blood, where motion sample is collected and we look at the presence of blood in that. So, or a CT colonoscopy, somebody doesn't want to undergo colonoscopy, we can do a CT virtual colonoscopy also, which can be done once in 5 years. So these are all the modalities for colon cancer, which are important. And then oral examination for somebody who is having smoking history or chews tobacco. So they can self-examine about the oral cavity, whether there is long-standing caries of the tooth, which again can predispose to oral cancer, or any white patches or red patches inside the mouth, or any patches over the surface of the tongue, or any hardening of the surface of the skin of the inside of our mouth. Like you can put a finger and then feel, or feel with your tongue. Any of these signs will indicate there might be a precancerous condition in the oral cavity. So these are all the common screening tests which will help to prevent cancers from progressing. Or many of them we can detect at a precancerous condition.
Okay. Thank you, sir. So, finally, what message would you like to share with our audience about awareness and prevention of cancer?
Okay, so the message I would like to share would be all of us need to understand that early detection is important for the reasons I told, and you need to come forward for screening, because the majority of the people will have fear that okay, I go for screening, what if something is found? So that's the reason which stops them from coming to the hospital. And so don't be scared, because detecting early will actually require less treatments later on, and then the chance of cure will be higher. So screening is important. Please do participate, especially women. Breast cancer and cervical cancer. Cervical cancer is very much preventable, and breast cancer detecting at early stage, the cure rates are very good these days. And make changes in your lifestyle. So starting from today, if you're not already doing, try to quit smoking. If you're not able to quit smoking, go to healthcare practitioner. They will definitely guide you. There are a lot of supporting replacement therapies, and many people, if they are usually successful in stopping smoking, you definitely stop alcohol, or at least try to limit the alcohol intake, and start doing some exercise. Maintain a healthy BMI. Don't become overweight, obese. Keep a check on how much calories, fats you are consuming. Limit very much your processed food intake. Processed foods not only include meat, sausages, and all. Even eating a lot of chips, a lot of biscuits, that's also not good. Think about healthy snacks. You can use whole grains, which have better glycemic index, and you can also like exercise is another thing, and know your family history. So know about your family history, and if there is a doubt, come to the doctor whether you require a genetic testing or not. So a genetic risk for cancer we suspect when there's a family history of at least 3 people with cancer, or at least one person or 2 people who had cancer less than 40 years of age, or 2 cancers in the same individual. So on one side of the family, if there are 3 people or more with cancer, or 2 people with history of cancer in less than 40 years of age, or there's a bilateral breast cancer, a male person having a breast cancer, pancreatic cancer, prostate cancer. These are all the indications to undergo genetic testing. And the final thing would be you can spread awareness. Whatever you have learned, you can tell your friends and family. Also, make them aware of the methods available to detect cancer early. Yeah. And don't be scared. Yeah, we need to be scared of the unknown. If we know, knowledge is always power. So
Yes, sir. So thank you so much, sir, for your valuable insights. I now request the audience to send in all your questions, put them in the Q&A section, and Dr. Kiran will answer them for you.
So I think first question for Mrs. Uma Maheshwari. Canned foods cause cancer, ready-to-eat foods cause cancer. Yeah, canned foods or canned meat especially is a class 1 carcinogen as per IARC. Ready-to-eat foods, again, like Maggie, is I think that's what it might be meaning. So all these ready-to-eat foods, if you consume on a regular basis, are definitely not good. Don't even think about cancer. There are deadlier diseases which are related to lifestyle, like diabetes, hypertension, heart diseases, strokes, kidney failure. You see, cancer is one part, but there are other diseases also which are caused by consuming a lot of canned ready-to-eat processed foods. Always try to eat freshly cooked, and prepare your own meals. It will hardly take 10-15 more minutes. Okay. And if you want to really have a Maggie, probably once a month, small amount now and then, but not on a regular basis. And can you please explain about the genes and its relationship with specific cancer? Is there any precautions? So precautions we cannot. It's not in our hands who you are born to. So we need to know the family history. That's a precaution. And if there is any, what happens in our society is if there is a cancer, people actually hide the information, and many times you won't know. So if you know that if you have an indication that somebody had some cancers, had some treatment, you can go and ask them. It will actually, they will tell you that information will be useful to you. You can always come and discuss with the doctor whether you require a genetic testing or not, and explain about the genes and its relationship with specific cancers. So genes, as I already told, we are all made up of proteins, and proteins come from DNA, and the DNA, the parts are called the genes. Okay. And there are all of us have all the genes. All of us, even the cancer causing genes are there in all of us, but they are in normal working condition. So when they become abnormal, they are called mutated genes. These mutated genes cause cancer. And for each cancer, the common example BRCA1 and BRCA2 is a gene which is normally seen in all of us. Okay, and it has a tumor suppressor gene. A normally functioning BRCA gene prevents cancer from happening. When it is not functioning well, then the cancer will form. Okay, so that is about the relationship with cancer. For others like pancreatic cancer, so let's say if I say BRCA gene, it causes breast cancer, ovarian cancer, pancreatic cancer, prostate cancer, and skin cancers. Okay. So that's all. So there are many different genes, and for each gene there is a syndrome, and each syndrome has a 3 or 4 different kinds of cancers. So when we know what gene a person has, we'll know what to look for. As well, we're just hitting blindly, right? So genetic testing is a simple blood test where around 10 ml of your blood is taken, and the results will come in 2 weeks' time. And it will all look at more than 120 cancer-causing genes are there. If anything gene is abnormal, you can easily find out from the blood test itself. So Sangeeta is asking, will skin allergy lead to cancer? No, allergy is usually easily controlled, and previously there can be a long-standing skin ulcers like varicose veins, which causes ulcers over the your ankle, and these chronic non-healing ulcers can lead to predisposed to squamous cell cancer of the skin. Otherwise, only allergy doesn't lead to cancer. More than that, exposure to ultraviolet radiation, which is an important cause for all types of skin cancer. So, using a sunscreen is important to decrease your risk. What if one or both parents had cancer? What screening or test to be done? So if one or both parents had cancer, it's only one person, right? So as I already told, there is few indications when we suspect a genetic reason for cancer. Usually, genetic related cancers happen in younger people. It won't Genes won't wait till you reach 70s or 80s, right? So less than 40 is an indication. And if both parents had that, we need to look at the further family history. If on dad's side, on his maternal or paternal side, or his mom's or grandfather or grandmom's side, there are at least two people are there with cancers at an younger age, we definitely need to do the genetic test. So screening will usually be decided based on the genetic test. So screening, as in I told about mammogram, pap smears. Let us say back, these are the and colonoscopy, and I told about low-dose CT. These are all for people with specific risk of smoking. We do low-dose CT. For other normal person, we do mammogram, pap smear, and the colonoscopy. But for somebody has a cancer-causing gene, for example, again, BRCA, which is common, I keep quoting it. So if BRCA is there, apart from mammogram, apart from pap smear, apart from colonoscopy, we also do an MRI of the abdomen to look at pancreatic cancer. We also look at ovaries. We do a test called CA125, which is a tumor marker. So the screening will be personalized based on the genetic risk of a person. Okay. So if there is a family history of cancer, you can always come and discuss with the doctor. You can come here. We have a hereditary clinic here, and we can decide later whether you will require a genetic test or not. Ideally, we perform the test on the person who is having cancer, like the parent. We need to do it only if the parent has a cancer causing gene. You will need to be tested. If the parent doesn't have, then you don't need to be tested for the gene. So people like us located in cities have to live with poor air quality index. Is there any way we can mitigate the risk due to air pollution? So yeah, talk it out. Keep talking about it on social media. Let it reach the policymakers. Let it reach the politicians so that a large scale action can be taken. But small individual steps might not have a major difference. People tend to use air purifiers, tend to use masks, which are reasonably okay. But then the amount of mental stress you go through, and the anxiety you go through trying to avoid the pollution and cancer, I think it's more harmful. So as much as possible, when there's a lot of smoke, like let's say a simple thing, like all of us travel in car, right? And we park our car outside under the sun. The lot of temperature inside the car will be very high, and as soon as we enter, we can sense that the smell is definitely not good. What do we need to do? Open the doors, windows, let the car ventilate for 2 minutes, then only start driving. Yeah. So these are the small things which you can do. Otherwise, air purifiers and all is not shown to decrease the risk of cancer. So all of us are in the same boat. So don't become anxious from today that there's an increased risk of cancer. Yeah, don't become OCD about it. So it's okay. You try to avoid crowded places, places with a lot of pollution as much as you can. You can travel in your car than your bike, and if you're traveling on bike, wear a mask so that you can decrease the amount of particulate matter. Okay. So can cancer be caused by non-stick cookware? Recently, there are reports that the surface, the Teflon coating, what is put on the non-stick cookware, the longer you use, the longer you heat, it can be converted into pro-carcinogenic compounds. So, if possible, decrease the use of non-stick cookware. Yeah. Thank you. Men to screen for cancer. What is the test called? So for men, so there are gender specific. For men is prostate cancer, right? And the test is called PSA, prostate specific antigen. But apart from that, a man also needs to undergo screening for with colonoscopy, once in 10 years colonoscopy, or stool blood once in a year. Yeah? And if you're a smoker, for oral cancer and lung cancer. For stomach screening, which test will detect cancer? Unfortunately, we don't have very good screening tests for stomach cancer. The only way to do is an endoscopy. So what I would advise is, if you're having some acidity or gastritis, if you keep taking some pan or Gelusil something, and if it doesn't settle in another 2 weeks, you always need to go to a gastroenterologist. Gastroenterologist will do an upper GI endoscopy, and then they will do a test called H. pylori. So presence of H. pylori bacteria is important to know, that because if you use antibiotics, the bacteria can be eradicated. That will decrease the risk of stomach cancer. Only uncontrolled H. pylori presence in your stomach, chronic gastritis, can increase the risk of stomach cancer. Otherwise, The early initial symptoms might be feel decreasing appetite. You feel full early, like early satiety. You used to have some 2 3 chapatis, but by one chapati these days you're feeling your stomach is full. It's called early satiety. This again is an indication to undergo an apergioscopy. So an endoscopy is a reasonably simple test. I think all of us can undergo only if you're having chronic gastritis symptoms which are not resolving on acid suppressant for at least 2 weeks. And once detected and chief, probably cured, will it come again? So again, as I said, it depends on the stage of cancer, and significant number of patients get cured. It all depends on how you look, whether glass half empty or half full. So there is always a chance that cancer can come back, but you will be on follow up after the treatment. So don't worry about it at this point. Yeah. And how much it costs to have an investigation on cancer. So we cannot, again, this is the first thing I told, don't lump cancer as one single entity. It's a group of diseases. It all depends on symptoms and screening. It says, I'll talk about the cost of the screening. A mammogram in a hospital will cost around 500 rupees. A colonoscopy might cost around 3000 rupees maximum. And a low-dose CT scan might cost around 1500 to 2000. A pap smear is probably some 200 300 rupees, and with consultation around 700 800 rupees, and HPV DNA come a bit extra around 2000. So these are all in the manageable. Most of you will be having some health insurance, and this health insurance will cover preventive health checkups. So once in a year, at least you can use that to do screening tests. But when a cancer is diagnosed, we need to type the cancer, stage the cancer. To know what type of the cancer it is, we need to do a test called biopsy. Take a small piece of the tumor and look at a microscope. The biopsy, depending on how do you do the biopsy, it might cost in some thousands, 10,000 or 15,000 or so. And then staging PET scan is usually around 10,000 rupees, and some basic blood tests. So probably even if somebody is diagnosed with cancer, the workup to detect the cancer might somewhere around 30,000 to 35,000 is a reason approximate estimate. Yeah. And there are low cost hospitals, like this is a not for profit trust hospital. There are government hospitals also. Yeah. So there will, you just need to approach a doctor, and then doctor will guide you. Okay. And well, Srini Vishnu Mohan, hello doctor. Are there any blood tests to detect cancer? Will a routine CBC indicate early onset of cancer in the body? No. CBC will not indicate early onset of any cancer. CBC will be altered only if the cancer is very much advanced. Only in a colon cancer in elderly males, if there is anemia which is unexplained, then we suspect a colon cancer. But otherwise, we don't want to reach that stage. Everybody should undergo colonoscopy and detect at a polyp stage itself. And recently, there are many advertisements on newspaper, a simple blood test, tumor markers. So there is no evidence to do any of these tests which are shown to have to detect cancer at a very early stage. So at this point, I do not strongly recommend any routine blood test to detect cancer. You can do tumor markers, which doesn't harm, but I think it's unnecessary spending money if you want to do it for all the patients. I read that low carb or ketogenic diet can be helpful to reduce insulin and reduce proliferation of cancer cells. Will you agree with this view? So reduction of insulin is something which I agree with. The way you do it, each person is different. Somebody follows keto diet, somebody follows low carb diet, somebody follows only fat diet. So I think we think all of us need to use our common sense and think about a balanced diet. Don't do anything extreme. Yeah, I had a patient who, after reading that carbohydrates can cause cancer, completely stopped eating while he was on taking chemotherapy. Do you think that makes sense? So anything you feel as an extreme thing is usually not good. So everything in moderation. Try to maintain a normal BMI, like the lean mass in your body. That is the muscles. Muscles need to be more. The amount of fat needs to be less. What do you need to do for that? Do you need to definitely go on keto diet? No, just reduce your intake, go for a walk, join a gym. You will definitely lose your weight. Maintain the BMI, which is actually exercise along with a good diet is actually helpful than an extreme diet without any physical activity and a lot of stress. Yeah. And is any cancer psychosomatic? So people here, I think, I'm not sure, I don't understand the question well. So psychosomatic, whether stress can cause cancer, there is no kind of thing, but you can always think that stress will definitely decrease your immunity. Immunity is an important thing to prevent the occurrence of cancer. So most of us will have cancerous cells forming in our body almost every day, and our immune cells will detect and kill the cancer cells in an early stage. Only if the cells escape the immunosurveillance, then only they will form into actual cancerous tumors. So reduction, like whatever helps our immunity to work better. And again, at this point, don't go into some diets for take turmeric every day. These are again use your common sense, which are extremes and which are actually go along with your day-to-day lifestyle. So the only way to maintain good immunity is having a well-balanced diet and exercise. These two things are sufficient. And yoga is very useful thing. Yoga, there are many clinical trials also which show that yoga reduces the risk of recurrence of cancer. Patients tolerate the chemo treatments all better. So try to decrease your stress in whatever way feasible for you. Okay. And yeah, is vaccinable for cancer? Yes. Please tell everybody. HPV vaccine is available for to prevent cervical cancer, the second most common cancer in the country in women. And HPV vaccine is usually given for teens, girls and boys at around 9 to 12 years of age, which is the ideal age. 2 doses of vaccine will be sufficient. So, does squamous cell cancer in skin successful operator lead to metastasis in 85-year-old man? This question is too specific to answer without knowing the details. Yeah, but squamous cell cancer of the skin cancer usually is detected early, and usually after surgery, many patients do well. And it can metastasize. There's a possibility, but it's not so common. What are the symptoms that can identify at the initial stage? As again said, we should not wait for the symptoms to happen because it won't be initial stage by the time the symptoms happen. My mother had buccal mucosa oral cancer at the age of 55 years. Other than her, no other family members suffer from any cancer. Is it required for me to do the test? If yes, what test needs to be done? So oral cancer in your mom, unless mom had any habit of tobacco chewing also, it might be related to HPV, human papillomavirus, but it's not a hereditary cancer, which is far from generations. So, if you're a smoker, you go to a dentist and get your oral cavity examined. Otherwise, you don't traditionally require any specific test to diagnose the cancer. Is there any specific cancer that doesn't have or shown any symptoms? Yeah, most of the cancers. So, an early stage lung cancer, most of the cancers won't have symptoms in the early stage. So why is there is no cancer in the heart? There are cancers in the heart. Okay, so there are many tumors in the heart. There's a common thing called there's a myxoma which happens on the inner lining of the heart, and the heart has a muscle layer. The sarcoma can happen in the muscle layer of the heart. There are many different kinds of sarcomas, and cancer from other parts can actually metastasize to cancer. Lung cancer can go to the heart. Lymphoma can happen in the heart. So melanoma can go to heart. So there is cancer in the heart. I think that's the end of all the questions.
Yes, sir. So thank you everybody for posting your questions. And this brings us to the end of this insightful webinar. Thank you, Doctor, for sharing your expertise with us. And thank you, dear audience, for joining us today. Your health matters. So yes, stay informed, prioritize your health. For affordable and holistic cancer care, please do visit Shringeri Sharada Equitas Hospital. It's in Gaurivakam, Chennai. So take care, stay strong, and thank you for attending the session. Thank you.
Thank you. Thank you.